Not me, but for a friend. Can someone please direct me to exactly what's the difference between ischemic and non-ischemic? Right here, I have Kerry Baker. Kerry, what's the difference?
Oh man. So
I love having Kerry.
so VA defines ischemic heart disease, and I say VA defines it, and I'm not saying that because they get to come up with their own medical opinions on stuff. They do sometimes. They took the ischemic heart disease defined as Harrison's defined it, which is a medical manual, and it basically means a diminution of blood flow to the muscle of the heart. Okay, well, what does that mean? All right, that's that is the VA's defined ischemic heart disease. But in layman terms, okay, there are certain things that are automatically considered ischemic heart disease, coronary artery disease, heart attack, angina, or atherosclerotic heart disease. Um, and really, what you're talking about there, 90% of the time, is coronary artery disease. And that's not the only thing, but that's the majority of what ischemic heart disease is. And that's a clogging of the arteries in the heart muscle. Okay. Now, outside of that, a heart attack, okay, is considered ischemic heart disease. And that's a little odd because you can have a heart attack and not necessarily have clogged arteries in your heart. Okay. But if you've had a heart attack, that's IHD. If you've got coronary artery disease, that's IHD. Uh, if you have angina, that's IHD, although you can have angina from things that are not ischemic.
Right.
So it gets a little weird in certain areas. All right. What's not ischemic? Okay. Afibrillation, AFib. All right. Your heart, I think if your heart beats too fast, too slow, or whatever it may be,
Erratically.
your uh, sinus arrhythmia. Okay. That's the, that, not, and some of that stuff can be fairly serious. Okay. But it doesn't involve the coronary arteries. Okay. You've got an electrical portion of your heart that keeps the beats in rhythm. Okay. If that and that's where you see a pacemaker. The heart needs to keep beating at a certain pace. The pacemaker makes it keep pace. So you that you could have a pacemaker it had nothing to do with coronary arteries. It could be an electrical problem in your heart, right? And you might not have clogged arteries, you might not have a heart attack, none of that. Another thing, now this is getting to a gray area because you're talking about another presumption. But before hypertension was a presumptive condition, you could easily have non-ischemic cardiomyopathy or congestive heart failure where your heart's enlarged and the muscles have been damaged and the heart just can't pump the blood anymore. That's heart failure. Now that can be caused for ischemic reasons, coronary artery disease or whatever, but it can also be caused by non-ischemic reasons. Right?
Right.
Uh, High blood pressure in and of itself is not heart disease per se. It kind of is, but it really isn't. But that's presumptive now. Okay, so if you've got high blood pressure and you're exposed to herbicides, and you've got non-ischemic uh, congestive heart failure because of that high blood pressure, but now you've got another route to get that heart service connected that might not be ischemic heart disease. Okay, so that's kind of it in a nutshell. The easiest way to think about it is without some of the outliers, coronary artery disease, clogged arteries in your heart is ischemic heart disease. No clogged arteries in your heart is typically not ischemic heart disease, and there are some outliers.